Aloha. I participated in this hackathon run by Lablab.ai, Lokahi Innovation in Healthcare. This hackathon was supposed to run 2 days on the weekend, December 6th to December 8th, and I finished my project for the December 8th deadline, but they extended the deadline for another 2.5 days until Wednesday. So I spent that extra time adding more features and doing some cleanup in my project. My project is Health Equity Explorer. The data set which they dropped on the Friday night before the hackathon started has 900,000, like more than 900,000 members' data records. And that was too much for me to process. As a single data set. So what I did was I split up that data set into 10 groups, or I call them cohorts, with the first nine cohorts having the records for 100,000 members each, and the last cohort, the 10th, having the remaining data for the 7,000 plus members. So how you use this app, this Health Equity Explorer app, is Um, there are 10 drop downs here, one for each cohort. So you select the cohort you want to see the data visualizations for, and it's going to load the visualizations. For example, healthcare access by member state. So for this uh, data is for these states here, and you can look at the service usage by race, total cost by race, usage by gender, total cost by age. Now, there's a lot more visualizations you can look at, and I grouped them as these buttons here. So we can go to the diagnosis distribution, and instead of selecting each cohort, like the intention here with these drop downs, you can like look at this cohort and the next cohort of 100,000, cohort two, and then you can compare like, the, the groups or the cohorts. What you can do instead is you can use the expand all button, which will go through each of these drop downs, each cohort, and expand the visualization. So this is about diagnosis distribution by race for these diagnoses. And you can also look at diagnosis costs. So let's just expand all. So this is average cost for the diagnosis for these diagnoses here by the different races in these states: California, Hawaii, Washington, etc. You can also look at individuals diagnosed. Let's expand all. This is a heat map showing the count of the individuals who are diagnosed um, by race. So you can see here African Americans or uh, diseases of the digestive system. There are 96 in this cohort, in this population. And when you expand all, it just keep scrolling here. It's going to load the visualizations for all the cohorts, like including the last one, which only has the remaining 7,000 plus members data. Asian diseases of the respiratory system, only five. I'm Asian, I'm Chinese, and I noticed that Asians have the lowest values typically. So what else? Chronic condition prevalences. Let's expand all. These are the chronic conditions and the prevalence by race. So prevalence meaning the number of individuals who have this condition for that race. You can also look at chronic uh, condition procedures. Oops, no, that's still the preference. Procedures here, right? Yeah, I didn't. I didn't update the title here. It still says prevalences. These are the number of procedures actually. Okay, so you can see like 2 million of procedures for renal failure for the other race being like not Caucasian, Black, and Asian. Let's go back here. You can also look at service settings, and let's expand all the cohorts. And this is the number of services for the different settings, like outpatient or inpatient, professional or prescription, I guess, RX. And it's split by year, and by race, as you can see at the top here. And you can look at ethnicity comparisons. Okay, this is taking a while to load. Okay, loaded. Yeah, this is a lot of data, so loading the data, it takes some time. The ethnicity, Hispanic or non-Hispanic or other, you can see the service usage and the total cost. And lastly, there's provider availability. This is just a map showing for each state the number of providers. Like Kansas here, 865 providers. Hawaii, over 17,000 providers. California, 185,000 providers. Okay, so that's my app, the Health Equity Explorer, and this is a retake of my demo video because I did a video after my initial submission on Sunday night, but since the hackathon got extended until Wednesday, this is all the bells and whistles. Mahalo.